Welcome back, guys. Today we're going to discuss this topic of respiration, respiratory physiology, that is mechanics of breathing. Previously we have discussed the structure function relationship in the lungs. Today we are going to start this mechanics of breathing. So let's get started. So as we know, this breathing comprises of two parts. Okay, our inspiration and expiration. Inspiration and expiration. Okay, so with this we are going to first start with our Boyle's law. Okay, what does our Boyle's law says? You must be knowing all this. But Boyle's law says that pressure is inversely proportional to the volume. Under any circumstance, pressure is inversely proportional to volume. Pressure is inversely proportional to volume. Okay, the volume we are considering here is our tidal volume. Okay, tidal volume is our 500 milliliters. 500 milliliters at rest. Okay, tidal volume 500 milliliters at rest. Now this pressure P factor, we have in the lungs three pressures. Lungs, three pressures. Okay, the three pressures we are going to discuss one by one. First is at the level of pleura. At the level of pleura, what do we find? We find the intrapleural pressure. Intrapleural pressure. Okay, at rest, intrapleural pressure value is always negative. Value is always negative. Okay, which is minus 2.5 millimeters of mercury or minus 3.4 millimeters of water. Okay, anything can be asked, and remember 1 millimeters of mercury, which is equal to 1.36 cm of water. According to this conversion is done. At rest, intrapleural pressure value is always negative, minus 2.5 millimeters of mercury or 3.4 centimeters of water. Okay, now when this intrapleural pressure is positive, okay, when this intrapleural pressure is positive, only during forced expiration. Very important point. Positive intrapleural pressure only during forced expiration. Okay, now we've seen at rest. Now we'll see what happens during inspiration. Okay, in forced expiration we have seen it is positive, at rest is negative. We know in inspiration we takes in the air and the volume increases. And we know from Boyle's law pressure is inversely proportional to volume. If volume increases, pressure falls. So intrapleural pressure falls during inspiration to minus 6 millimeters of mercury. Minus 6 millimeters of mercury or minus 8 millimeters of water. 1 millimeters of mercury, again I am saying 1.36 cm of water. Very important here. Intrapleural pressure falls in this inspiration, becomes more negative. Becomes more negative. Very simple. To minus 6 millimeters of mercury or minus 8 centimeters of water. Okay, so during inspiration intrapleural pressure becomes more negative. During expiration, okay, we know we exhale air and volume decreases. Volume decreases, pressure is inversely proportional to volume. Volume decreases, so pressure rises, and during expiration intrapleural pressure rises or increases. Okay, increases to how much? To its original value. What is its original value? Minus 2.5 millimeters of mercury or minus 3.6 centimeters of water. Very important concept here. Intraocular pressure, when negative, when positive, when increases, when decreases. First we remember the Boyle's law, then after becomes it easy what happens during inspiration and expiration, and only positive during forced expiration, otherwise at rest negative. Now the question comes to your mind, why intraocular pressure is negative? Why intraocular pressure is negative? We have an interesting mechanism here. I'm going to discuss it. See carefully here. Suppose this I am drawing here is our pleura. Okay, is our pleura. Inner to this pleura we have our all important lungs, and outside to this pleura we have our chest wall. Attached to this pleura is our chest wall. So we have three components here. Pleura. Inside this pleura we have our intrapleural pressure. We are going to see why it's negative. Inside to this pleura lungs, outside to this pleura attached is the chest wall. Very simple. Now we know this lung is an elastic organ. It has its elastic property. Okay. Now its normal tendency is to move inside. Elastic organ, lung, its normal tendency is to move inside this direction. The movement is in this direction. Okay. Now we'll see the chest wall. Chest wall is also elastic. Okay, like the lungs, the chest wall is also elastic, and its normal tendency is to move outside. It's to move outside, outwards. This is the direction. So now this pleura here, will change the color. This pleura here is subjected to two opposing forces, in opposite direction, and it undergoes stretching. Okay, and which results in between vacuum is created. Two opposing forces undergo stretching and vacuum is created, and as a result pressure becomes negative. Pressure is negative. How much negative? What is the value at rest? Minus 2.5 millimeters of mercury. So the pleura, inside it is the lungs, outside it is the chest wall. Lungs, elastic organ, its normal tendency is to move inside. Chest wall is also an elastic organ, normal tendency is to move outside. So pleura is subjected to two opposing forces and in turns getting stretched. Vacuum is created, and we know the pressure inside vacuum is negative. Value of minus 2.5 millimeters of mercury. So this was our intrapleural pressure. Moving on, we have our pressure at alveoli. Very simple, alveolar pressure. Alveolar pressure, in short AP. Pressure at the level of alveoli, alveolar pressure. First at rest, okay, value is always 0. Always 0 millimeters of mercury or centimeters of water, whatever you can say, but the value is always 0 at rest. Okay. Now inspiration, okay, we know volume increases, pressure decreases, P is inversely proportional to volume, so alveolar pressure falls. As volume increases, we take in the air, pressure falls to a value of Obviously from 0, if it falls, it will go to a negative value, minus 1 centimeter of water. Remember, here only centimeters of water is calculated, the alveoli. Okay, because alveoli in the inside surface is actually covered by water molecules. Okay, we have discussed this in the structure function relationship of the lungs. Go check that one out. So inspiration, AP falls, negative value of minus 1 cm of water, and expiration, volume decreases, pressure increases. Pressure is inversely proportional to volume. We will apply this everywhere. Pressure increases, so alveolar pressure increases to a value of plus 1 cm of water. Plus 1 cm of water. From minus 1 cm of water through 0 cm of water to plus 1 cm of water. So we see that it fluctuates between inspiration and expiration between minus 1 and plus 1 centimeters of water value, the alveolar pressure, and at rest it is always 0. So we have a graph here to understand. Okay. Y-axis and x-axis we draw. Okay. On y-axis we have a pressure, x-axis we have volume. We already know this. So we draw the graph here. Okay. Starts from here, goes to at the peak, becomes negative and comes back to 0. What is this positive value? Plus 1 cm of water. What is this negative value? Here, minus 1 cm of water. This is at 0 level. Pressure increases when this happens during what? Pressure increases, so volume decreases. When our volume decreases, this all happens during our expiration. Very simple. And pressure decreases, volume increases. What happens during this our inspiration? Okay. Now the takeaway point from here, okay, is two facts we need to remember here. Two very important facts we need to remember here. Okay. Alveolar pressure AP at the end of inspiration. At the end of inspiration. Now what is the at the end of inspiration? This is at the end of inspiration. This one. 0 centimeters of water. If it was asked alveolar pressure during inspiration, what becomes a positive value or negative value? It's a negative value of minus 1 cm of water. This one I was interested in discussing with you. At the end of inspiration and during inspiration. At the end of inspiration returns back to 0 centimeter of water, and because at the end of inspiration we are at rest. Similarly, alveolar pressure at the end of expiration. At the end of expiration we are at rest, so 0 centimeters of water. If alveolar end during expiration, peak value what it reaches? Yes, plus 1 cm of water. Now always remember this value. So it fluctuates between minus 1 to plus 1 cm of water. Okay. Yes. So we've seen the alveolar pressure here. Okay. At rest 0, inspiration becomes negative to minus 1, expiration is plus 1. We've seen the graph here, and we've seen the two important points here: at and during. At and during. At 0 centimeter water during the fluctuation values at 0 cm of water. Very important discussion here about alveolar pressure. Okay. We have discussed two types of pressure. Third type of pressure to discuss here: pressure at level of lungs. Okay, what is this called? Transpulmonary pressure. Transpulmonary pressure, TP. Okay, what is this TP? Transpulmonary pressure. Transpulmonary pressure is equal to alveolar pressure minus intrapulmonary pressure. This is the formula, alveolar pressure minus intrapulmonary pressure. So we are going to count it for 3 stages. First is at rest. Transpulmonary pressure. At rest, alveolar pressure is 0 centimeters of water or 0 millimeters of mercury. Minus, what is the intrapulmonary pressure at rest? Negative value of minus 2.5 cm of millimeters of mercury, or minus 3.4 cm of water, whatever we write, equal to minus is a positive value of 2.5 millimeters of mercury or positive value of 3.6 centimeter of water. Very simple calculation here, nothing to understand here. At rest is a transpulmonary pressure is a positive value, alveolar pressure minus intrapulmonary pressure. Remember, this transpulmonary pressure is a distending pressure. Distending pressure. Okay, what is meant distending pressure? Keeps our alveoli distended or expanded. It does not allow the alveoli to collapse. Okay, doesn't allow the alveoli to collapse. So the transpulmonary pressure is a distending pressure. Very important fact to be remembered here. Distending pressure keeps our alveoli distended. Which? Transpulmonary pressure. Okay, so this was discussion about all of our pressures, and these pressures are described at the levels of tidal volume, which is our 500 milliliters of air at rest. Okay, tidal volume air. 3 types of pressure: intrapulmonary pressure, alveolar pressure, and transpulmonary pressure, which is the difference between alveolar and intrapulmonary pressure. Remember, the formula can be remembered here because the alveoli keeps the alveoli descended, so the pressure is difference between alveolar pressure and intrapulmonary pressure. Okay, it's a distending pressure. Moving on, we are expand our discussion to respiratory muscles. Respiratory muscles. Fairly a small topic, but an important topic. Questions asked before. So in respiration, we always have 2 parts: inspiration and expiration. So we have inspiratory muscles, and this side we have our expiratory muscles. Okay, major inspiratory muscle. Remember, it's always diaphragm. Whatever muscle you remember, doesn't remember, major inspiratory muscle is always diaphragm. You have to remember it. And then there are accessory muscles. The accessory muscles, scalene group of muscles. Scalene group of muscles. Scalenus anterior, posterior, this group of muscles. Then our sternocleidomastoid, important inspiratory muscle, SCM, sternocleidomastoid, and our external intercostals. Okay, scalene group of muscle. Then as far as sternocleidomastoid, including external intercostals or accessory. Major is our diaphragm. Moving on to expiratory muscles, major muscles. So we know the major muscles here. What are the major muscles? Expiration is at rest is a passive process. Expiration at rest is a passive process. So no muscles are involved. Remember this very important concept. At rest is a passive process. No muscles are involved. when muscles are involved during expiration? Yes, forceful expiration. Forceful expiration during exercise activity. We have our rectus abdominis, six pack muscles, rectus abdominis, transverse abdominis, the abdomen muscles, two abdomen muscles, and our internal intercostal muscles. Internal intercostal muscles. This is a fairly opposite thing here. That for expiration we use internal intercostal, and for expiration internal intercostal, and inspiration we have external intercostals. From these two, if these two are solved, then these two, remember, will not be that difficult. Here the scalene group and sternocleidomastoid straight for inspiration, and abdomen, rectus abdominis and transverse abdominis for forceful expiration along with internal intercostal. And during rest, expiration is a passive process, no muscles are involved. Moving on, we'll start our discussion of very important concept or topic here. It is our compliance. Okay, compliance. So let's start our discussion. First we'll go with alveoli. It's structured of alveoli. Sorry, let me draw this again. These are alveoli. Alveoli at rest. Okay, and we inspire. First is we do inspiration. When we inspire, what does the alveoli do? Distends, increase in size. Distends. Okay, distends. Here we have inside the alveoli, as we have discussed before, water molecules, which acts as surface tension force inside. Inverse the surface tension acts force due to the water molecules on the inner surface of the alveoli. This is our alveoli distended. Okay. Now this distension, non-tension, surface tension due to water molecules, distension of alveoli, okay, is called our all important compliance. Okay, this is the first important discussion we are going to see. The distension of alveoli on inspiration against the surface tension acting due to the water molecules is called our compliance. This is here our compliance. The first important concept to be understood here. Moving on, we will see the opposing forces to distension. Opposing forces to distension. Opposing forces to distension. Okay. What are the opposing forces to distension? First one is our due to water molecules, the surface tension acting inwards. Due to water molecules, surface tension acting inwards. Okay, surface tension we have seen here acting inwards. This is distension against the surface tension. These are compliance. The second one here, it is the second force, second opposing force. What is the second opposing force? Lung is spring-like nature. Spring-like nature. Okay. Elastic recoiling forces. Elastic recoiling forces. These are elastance. Elastance. Elastic recoiling forces lung spring. Lung is like spring like nature. Elastic recoiling forces, elastance. So as this elastance is a opposing force to distension, we come to the conclusion that elastance is inversely proportional to compliance. Compliance is a distension force, and elastance is acting against the compliancing or distension force. Okay, so your elastance is inversely proportional to compliance, or compliance is inversely proportional to elastance. Now see some clinical link here. What are the clinical links? There is decrease in elastance or our elastic recoil. Okay, this happens in emphysema. That's to what? Increased compliance. Why? Compliance is inversely proportional to elastance. Increased compliance or distension. It is increase in the alveoli size. Leads to over distension of lungs. In emphysema, it is hyperinflation of lungs. Hyperinflation of lungs. Very simple. Emphysema, decrease in elastance or elastic recoil. The recoiling forces of the lungs are gone. Leads to increased compliance or distension, over distension of lungs, hyperinflation of the lungs in emphysema. Okay. Now the second clinical, as you want to see here, pulmonary fibrosis. First we see in emphysema, pulmonary fibrosis. What happens that lung is stiff. Okay, less distensible or less compliant. For which it undergoes restriction. Called restrictive lung disease, RLD, restrictive lung diseases. And what is the example? Pulmonary fibrosis, less stiff, less distensible, less compliant. Restriction, restrictive lung disease. Okay, we have seen two things here. One is emphysema and pulmonary fibrosis. Two important concepts to expand the discussion on compliance or distension. Okay. Yes. Moving on, we'll see the measurement of compliance. Measuring compliance. Okay, how do we measure this compliance? First we'll remember normal compliance of the lung. Normal compliance of the lung, okay, which is 200 milliliters of air, okay, per centimeters of water. Okay, normal compliance of the lung is 200 milliliters of air per cm of the water. Now here we see 200 milliliters of air is our volume, this centimeters of water is our pressure. Okay, so we see that compliance is our change in volume by change in pressure. A ratio of change in volume by change in pressure. Very simple. Delta V by delta P. Compliance C is equal to delta V by delta P. Very simple understanding, very simple formula. Normal compliance of the lung here is 200 milliliters of air. 200 milliliters of air per centimeters of water. Normal compliance of the lung. Okay. Now we are going to see types of compliance. Types of compliance. First type we are going to see is static compliance. Okay, static compliance is during rest, okay, or during breath holding. Breath holding. Most commonly we use this during breath holding, static compliance. Second type is our dynamic compliance. Dynamic, static and dynamic. Dynamic means movement or during breathing. Okay, here airflow is happening, okay, to encounter resistance, and resistance is also called our impedance. Resistance or impedance, okay, encounter resistance or impedance. During breathing, airflow is happening to encounter resistance or impedance during dynamic compliance. Third type, let's see here, is specific compliance. Specific compliance. This is compliance of an individual. Compliance of an individual. Here we encounter the FRC, that is a functional residual capacity. Functional residual capacity. Specific compliance, compliance of an individual, which is a functional residual capacity. So we have three types: static, dynamic, and specific. Static is during breath holding, dynamic is during breathing, in which the air encounters resistance or impedance, and specific compliance, which is compliance of an individual, which is our FRC. I'm going to draw a graph to see how these compliance are related. What are the basics of compliance? You can derive from this graph. Y-axis, x-axis, okay. So this compliance graph, a dotted line, like goes like this, okay. Let me draw this one again. We all are familiar with this shape of graph, okay. Now important points to see here: this graph going upward is during inspiration, okay. This is our x-axis. The y-axis we have our volume, x-axis we have our pressure, okay. Pressure increases, our volume increases during inspiration. This downward graph is during expiration. During expiration, okay. Suppose this is our, here it is our, for a single value we are taking two values of a single pressure value, taking two values of volume. Suppose this is 2 liters and this is 5 liters. The value of is minus 2.5 millimeters of mercury at rest, okay. So this is the graph. It's upward going, here is our inspiration, and downward coming, this is our expiration. Now the compliance we know, delta V by delta P. This is our delta V volume here, this is our delta P here. So how do we calculate this delta V and delta P? This graph compliance is the slope of the graph, slope of the xy graph. These are delta V by delta P. and we draw a tangent somewhere here, and we calculate the delta V by delta P. This is our compliance from the graph, which is the slope of the graph. Okay. Now the one important point is that the direction of inspiration and expiration are opposite here. This is our inspiration, this is our expiration. The directions are different. Okay. Directions of inspiration and expiration are different. Why? Okay. This difference is called hysteresis. Hysteresis. Difference between the inspiration and expiration is called hysteresis. This is due to surface tension forces. Surface tension forces and our surfactants. In our surfactants, the surface tension forces due to the water molecules and our surfactants, which seeks to reduce the surface tension forces due to the water molecules. Now, another fact to remember here is change in volume is always more during expiration. Change in volume is always more during expiration. Okay, so obviously compliance is higher during expiration. These are delta V by delta P is higher during expiration. Okay, it's a very important fact here. Change in volume is more during expiration, so compliance is higher. Okay, the hysteresis is due to due to surface tension forces and surfactants. Now we'll see this was our discussion on surfactants and hysteresis graph. Okay, the last we'll see our work of breathing. Work of breathing. Okay, work of breathing. So we have our lung, we have our air in and air out. Okay, so the work done is our breathing. Okay, we will calculate how much of the work is done during inspiration and expiration. So we know that work, the formula is here, force into displacement. Force into displacement. Now from this physics, F into D. Work is equal to force into displacement. Now this force we calculate as a pressure changes. Pressure changes. This displacement is in our volume changes. So work delta into delta V. Okay, delta P into delta V. Force, pressure changes, volume, displacement is our volume changes. And remember, work done normal here is 0.5 kg meter per minute. Kg meter per minute. This is the normal work done. This is the unit here, kg meter per minute. Okay, yes. So moving on, we'll see how much of work is done by what in case of 100% efficiency. You know, 100% efficiency is a myth, but in case we have 100% efficiency, we'll see how much of a work is done. Okay, in case of 100% efficiency. In case of 100% efficiency, okay, I'll have two cases. 65% of work done, okay, is to overcome elastic forces. Overcome elastic forces, okay, and 35% of work done is to overcome elastic resistance. Elastic resistance, or the impedance that the lungs actually provide. 65% is to overcome elastic forces and 35% is to elastic resistance. Now here, out of these 65%, 2/3 of work done is to overcome surface tension. To overcome surface tension due to the water molecules, okay. The rest 1/3 is to overcome lung elasticity, lung tissue elasticity. This is the demarcation of the 65% of work done to elastic forces, out of which 2/3 is to overcome surface tension forces, okay. Now over to this 35%. 28% of work done is to overcome, 28% is to overcome airway resistance. Airway resistance. The remaining 7% is to overcome lung tissue resistance. Lung tissue resistance. Okay, this was our demarcation of work done in case of 100% efficiency. 65% is to overcome elastic forces, 35% is to overcome resistance. Out of the 65%, 2/3 is to surface tension due to water molecules, 1/3 is to lung tissue elasticity. Of the 35%, 28% is to airway resistance with the airway cells, and the 7% is to lung tissue resistance. Do revise them, guys. Very important discussion we have here, from compliance to the pressures, the volumes, the graphs, okay, and how the mechanics of breathing happens. Finally, we discuss the work done, okay. Very important topic to discuss. Thanks for watching, guys. I will see you in the next one. Good luck.